In this video, we'll be looking at the bones which make up the shoulder joint. We'll take a look at the muscles which form the shoulder joint and common movements of the shoulder, as well as taking a look at the rotator cuff muscles in a bit more detail using ultrasound. The shoulder joint is made up of the clavicle, the acromion and coracoid process, the scapula, and the humerus. We can take a closer look at each one in more detail. The clavicle articulates with the sternum medially at the sternoclavicular joint, which can be palpated here. Medially, there's a convex curve, which becomes a concave curve as you move laterally. At the lateral end of the clavicle, it articulates with the acromion to form the acromioclavicular joint. The coracoid process can be palpated 2 finger breadths inferior medially to the acromion, around here. In the lateral view, you can palpate the head of the humerus, which forms a ball and socket joint with a glenoid fossa. From the posterior view, you can palpate the inferior angle of the scapula, which is here. This is at the level of the 7th rib. Track the scapula along the medial border to find the superior angle. The superior angle is at the level of the 2nd rib. From here, you can follow the spine of the scapula, which terminates laterally at the acromion. The major muscles of the shoulder, which can easily be palpated, include the trapezius, the rhomboids, teres major, and the deltoid muscles. Let's start with the posterior view. With the shoulders in a slightly shrugged position, the trapezius muscle becomes more defined and is easy to palpate. If we ask our patient to relax and then bring their shoulder blades together, you're then able to feel the muscle mass of the rhomboid muscle at the most inferior part of the medial border of the scapula. Again, if our patient relaxes and then brings the arm behind their back in internal rotation, laterally you are able to palpate the teres major. From a lateral view, you are able to palpate the deltoid with the shoulder in abduction. This is what gives the shoulder its rounded appearance. The major muscles of the proximal arm, which can be palpated easily, are the biceps anteriorly and the triceps posteriorly. When the arm is held in a flexed position, the biceps and brachialis become more prominent and can be palpated. When the arm is in extended position, it's the triceps which becomes more prominent and you're able to palpate it. The shoulder is a ball and socket joint, which permits a wide range of movement. The following movements should be revised in conjunction with the shoulder MSK clinical examination to remember how to identify common pathology. The shoulder is able to cover flexion and extension, abduction and adduction, internal rotation and external rotation. There are 4 muscles which make up the rotator cuff. These are supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles originate from the scapula and attach to the humeral head. Their main function is to aid stability of the glenohumeral joint, but they also aid movement of the shoulder joint overall. The supraspinatus can be visualized using ultrasound, with the arm held in internal rotation. I've placed the transducer in the coronal plane anterior superior to the glenohumeral joint, with the proximal end of the probe on the acromion. So I'm going to shift the probe slightly, and if I freeze the image here you can see the deltoid superficially and the greater tubercle lying deep. We know it's the greater tubercle, i.e. a bone, because it's highly reflective and sound waves are unable to pass through. Superficial to the greater tubercle is the supraspinatus tendon. In this video, we looked at the bones and muscles which make up the shoulder joint. We took a look at some of the movements of the shoulder joint, and using ultrasound, we were able to identify the supraspinatus, one of the muscles of the rotator cuff.